Please welcome Beth Brown, Shane Jackson, and Dr. Ray Kotwicki.
Well, good afternoon, everybody, and thank you for sticking around. We promise that this hopefully is going to be a very useful and engaging conversation about mental health and the changes that we've all experienced post-pandemic. And I'm going to purport that this really is sort of an exposure of mental health problems and psychiatric illnesses that have been around forever. But when people are stressed out, they are revealed, not changed. And so what we've seen during the pandemic, I think really underscores the importance of mental health prevention and treatment writ large, and even in times when people are not stressed out. So I am Dr. Ray Kotwicki. I'm the moderator for the panel, and I am an adjunct professor of psychiatry at Emory University, and started off actually, as my mother used to say, as a real doctor. I went into internal medicine before switching into psychiatry, and then did a postdoc fellowship in public health. So it's really weird to have a psychiatrist who also is not afraid to do needle sticks, who also thinks about mental health from a public health perspective. And so for your trainees, I would argue that bridging gaps and thinking about the interconnectedness of things that heretofore have been very siloed is the wave of the future of medicine. And part of what I want to bring to our discussion today is the interconnections between mental health, physical health, and the social determinants of health. So it's been a real privilege to get to know the other two panelists. And I've asked for them to introduce themselves and in sort of short order, give a brief history of how they ended up in the careers that they've chosen. So we'll start with Beth Brown from the Blank Family Foundation.
Sure, and good afternoon, everyone. First of all, I'm delighted to be in this room. One thing is because the whales are there, and you can't be in the mental health and well-being field without learning ways to regulate one's own nervous system. And recently I read that you don't just have to be in nature to have some calming effect on your nervous system, but just to look at it. So if I or any of us get nervous throughout, we could just turn to the whales. The other reason I'm delighted to be in this room is that I work for the Arthur M. Blank Family Foundation, and many of you may know that Arthur, before he focused on philanthropy and the Falcons and the Atlanta United and the Mercedes-Benz Stadium, he was the co-founder of Home Depot. And it is his partner, Bernie Marcus, who really made the aquarium possible, so it's great to be here today. As the managing director of mental health and well-being for the Blank Family Foundation, I have the honor of developing a strategy to bring more mental health services to those in need. And we're in the process right now of really learning what the specific role of philanthropy is in solving that need. And I can talk more about that in a moment. But my path to this role has been coming from a career in philanthropy. Shane and Ray are real experts in the healthcare and the mental health space, but I'm coming at it from a different perspective, having had the honor of being in this real industry of philanthropy that's at the intersection of great generosity and great need. So I'll stop right there and look forward to talking more.
Thank you, Beth. And it's my pleasure to introduce Shane Jackson from Jackson Healthcare. Shane?
Yeah, thank you. And I think you can tell your mother you're still a real doctor. We should. So thank you so much for being here. It's great to be back at Health Connect South on this amazing event. And just, again, congrats to Russ and the team for 10 years. I had the great privilege of being with Russ as he was birthing this idea, and he's very gracious to recognize people, but he's just carried a tremendous amount of water on this and done a great service to our community. So our company, Jackson Healthcare, we're based here in Metro Atlanta, up in the Alpharetta area, but we have an amazing business. We get to make sure that people, wherever they are, have access to care when they need it, and so we work in all 50 states. in any kind of care setting that you can imagine, anywhere a patient is, there's a chance that we'll have a caregiver there. We do that through a number of ways, staffing, technology, and various things. But one of the things that we do that most people probably don't realize is we do a tremendous amount of work in mental health field. So we have, this year we'll have about 7,000 mental health providers that we will have working in various care settings all around the country, again, in all 50 states, about half of which will work in state and community based systems. And so we're pretty familiar with what happens both in the private and the public area of this. And it's also just a topic that's kind of a personal passion for me. I'm not the expert. The expert is down on that end, but it is something that I care a lot about. And Dr. Cooley asked us to talk about kind of our path to getting here, and I don't think we have time on for that whole story, other than to say it was awesome getting to meet a lot of the students beforehand, and I will say when I was a student, I had absolutely no clue that this is what I would be doing with my life. And I think probably some of you, the rest of you in here probably had similar experiences where you come out of college, and if you're not, going to medical school or maybe law school or something, you probably like me, you graduate and you're like, I'm not qualified to do anything, right? And so I think that things work out and you end up in the place that you need to be. And I was very just lucky to get a job in healthcare and in this great industry, and it's propelled where we are.
Well, thank you, Shane. It's been an utter privilege getting to work with you, Beth, and you, Shane, and so thank you for making this such a fun experience. Unfortunately, when we talk about mental health or behavioral disorders or brain diseases or psychiatry, we have to start with a topic that is really uncomfortable, which is that of stigma. And when I was a new graduate of my psychiatry residency program, I used to, when I was riding on planes, lie and tell people that I was an architect. And it's changed, and I'm really heartened that Dr. Cohen brought up the importance of mental health and opioid addiction in her discussion. I'm heartened that we're talking about this at all in a healthcare conference, because in the old days, psychiatry used to be the ugly stepsister of medicine, and people believed that if you had a mental disorder, you had a character defect, or all you needed to do was pick yourself up by your bootstraps and try harder, which in my opinion is as ridiculous as telling somebody with cancer that they just need to try harder and their lymphoma will go away. So one of my objectives today is to try to convince you that mental illnesses are medical problems. And if we expect that society and payors and businesses and philanthropy will support medical problems, physical medical problems, I think that we need to look at it in a way of parity, that mental illnesses and mental health problems fit exactly that same paradigm. So with that, and the idea of stigma, Beth, why would a philanthropy organization have any interest in supporting mental health?
Well, the Blank family, like so many families, really believes and has been personally touched by well-being and mental health, because mental health is health. So it's to separate the mental health from the physical health is something that we've done in conversation and with the way we've organized work, but it's not how we really operate as humans. And I think Arthur Blank has always been in the people business. And for those of you who are leaders and business owners, you have a deep appreciation that you cannot function as a healthy business without having healthy people in your business. So I think part of the family's dedication to this issue starts from that. And I also think we're in a new moment related to the stigma that blends over to philanthropy, is that now that we're talking more about mental health, people aren't just sharing their stories, they're willing to open up their generosity and give more to this, really what I see as a new and evolving field of mental health philanthropy. So we're hopeful that many other families will join us in partnership in funding mental health and well-being strategies.
Shane, same question to you. What is the role of business and thinking about the integration of mental wellness into workplace?
Yeah, I love that you asked this question because it's something I'm passionate about. I think as a business person, as a leader, you have to start by understanding that this is impacting you at work. Perhaps it's impacting you personally, someone in your family, perhaps someone who works with you on your team, and it's almost certainly impacting you through a loved one of someone that you work with. I mean, that's just how pervasive these challenges have become. And so, we were talking about this earlier, that as I talk to other business leaders, this is a topic that largely we're afraid of because I'm not an MD, I'm not a psychiatrist, I'm not a counselor, I don't know how to do that. Oh, and by the way, like, you have all these regulatory laws around, like, there's only some questions I can ask and some I can't. And if I know this thing, then I have to do all these others. And it's a really, really difficult place for our businesses in the business community to engage, and yet it's impacting us. And I think you just said this, but your team, your ability to perform your service, to provide what you provide, is directly related to the quality, readiness of your team. The other thing about this that makes it even harder is that, and I think we're going to talk about this maybe a little bit later when we talk some about social determinants, but is we're in a society where our community organizations either have broken down entirely or are in the midst of breaking down. And so if you are in a business, you may be one of, if not the only places where someone who is in position is struggling, the only place that they actually are engaging with other people. And so we have not only a business impetus of, like, we have to, in order to accomplish what we need to as businesses, we have to help people through this. I would argue we also have a moral obligation as one of the kind of last bastions of being in a position to recognize and point people towards the help that they need. And we can talk more about this. I have a lot of passion about it, but I think that while we all can't be professional caregivers, we have a role to play, especially as leaders, in the environment that we create that allows people to live holistically well lives. And I think that's good for business, by the way, but I think it's also incredibly important for our communities, and especially when we talk about mental health.
Just to add on to that, it's both the good news and the bad news that we all have a role in this, and we all have a responsibility, and not to try to be clinicians at all. But the Surgeon General's report, and I know you're going to mention this, recently said that half of Americans are lonely. And lonely as distinguished from social isolation. So we learned about social isolation in the pandemic, when you're actually isolated. But loneliness, as we all know, can be a feeling when you are amongst people. There's also research that people do not feel like they belong, and we're investing in some measurements on belonging and some tools and coaching for how do you feel like you belong. But if it's the case, and I assume it is, from the research that 1 out of 5 people are either directly or through their family experiencing some mental health challenge, it's been helpful to me to go any room that I'm in to divide that by 5 and assume that that is everyone. It is all of us. And so taking on some responsibility about how do we change conversations, again, not to be clinicians, but to truly see one another. there's a question that I love that's different from just how are you? Fine, which is what's it like to be you right now? And that's something that we can all do to really try to bridge loneliness.
Love it, thank you. And I think you're pointing out the really important fact that there's a role for businesses and employers, philanthropy, charity, other things, to help people access mental health services. But that presumes that there are clinicians. And for the counterpoint, some of you really should be clinicians. It's an amazing job, and I would highly recommend it. But there needs to be people who are educated and able to provide evidence-based, research-driven treatment for patients who, or people who don't identify as patients, who require mental health services. And one of the things that we saw in the pandemic, according to the Centers for Medicaid and Medicare Services, was that because of telehealth and because of the newly identified need for mental health services, the number of people who access mental health services increased by 30%. However, the number of clinicians who were available probably decreased or at best remained relatively flat. So there's a real delta between the supply and demand. New people have identified that they could benefit from mental health services, but there really aren't enough folks to provide excellent mental health services for everybody who needs them. So Shane, I want to start with you. How do you address the disparity between the supply and demand, and what do we need to think of as a culture in terms of making sure that there is accessible, great mental health care for people who identify the need to use it?
Yeah, so as I mentioned earlier, I can geek out on the data around supply and demand, and I'm not going to subject you to that, other than to say, understanding that there is a significantly more demand for mental health providers than there are supply. And you know, to talk for a moment specifically about psychiatrists, you know, just to kind of quantify this, so for us, every time we send a psychiatrist somewhere to care for patients, there's 2 other places saying, well, why can't we get them? I mean, that's just kind of the way it works, and that hasn't changed. In fact, it's gotten even worse. One of the, and I was looking at the data yesterday, but one of the real pain points right now that we're seeing across the country is people who can work in the area of addiction. And I mean, it is just, I mean, you heard the CDC director talking about some of these numbers earlier, and there are just not that many psychiatrists who have that training and can even administer some of the procedures and things that are involved with that. The other place I would say we're really seeing it is in pediatrics. And again, I was just looking at some of our internal data yesterday. In the last 24 months, the demand for pediatric psychiatrists has gone up by 22%. I mean, it's just, that's, you know, you're just talking a really big number. One of the things that makes that particularly difficult is that, you know, where we see, you know, across the country, advanced practice providers being leveraged in interesting ways. That's not, with nurse practitioners and pediatrics, that training is not nearly as prevalent. And so it just compounds the challenges around pediatrics. We see this, of course, everyone knows, you know, what's been happening in nursing, you know, over the last few years, and certainly, you know, the mental behavioral health area has not been immune to that, to say the least. It's been a huge challenge to get. And then I would also say something that we don't think about as much, but is even at the area of like aides and the vocational nurses. I mean, I would say surprisingly that may be there, especially with the states that we work with, that might be the area where they're struggling the most. Because all of a sudden you have someone who is doing one of these jobs, and now they can literally go down the street to Starbucks and make more money. And by the way, making coffee is way easier than what we ask these people to do. I mean, they're just incredibly difficult jobs. And so, I think, first of all, we have to recognize as a community that especially when you're talking at the MD level, the top level, we cannot train enough physicians to fill the needs. Like, we just can't. It's not going to be done. And so you have to say, okay, well, then we have to solve it in other ways. And one of the things that's frankly been very encouraging to me, even sitting here today, is hearing comments like from, if you were in for the academic medicine this morning, and several of the other people who've been on stage talking about the team-based approach that has to happen. I mean, you and I were talking about this the other day, and you were talking about the increased complexity of the patients that you're seeing, and we're seeing that everywhere. We have to leverage our scarce, precious resources of psychiatrists to lead care and deal with and doing the things that only psychiatrists can do, which means we have to think all the way through all those team members, everything we can, and make sure we're using them in the right ways. And I think in some places, and especially in states like Georgia, that's going to mean we're going to have to rethink some things. But it's frankly, we don't have any other option other than to figure out how we're going to treat people, help people by leveraging as many resources as we can.
Yesterday in JAMA Open Access, there was a study from the Nurses Phase 2 that showed there was a relatively linear relationship between the amount of overprocessed foods that somebody eats and the likelihood that they'll develop major depressive disorder and anxiety disorders. So to your point, that doesn't necessarily have to be a role that a psychiatrist has to have a conversation about nutrition. It absolutely has to be a part of the comprehensive treatment recommendations, however. So I think using expertise in the appropriate way and not thinking about mental health issues as only brain diseases, but diseases that affect your entire body and may be associated with other things like inflammation. And I'm going to talk about that in a second. Beth, there are other groups, though, who historically have even a harder time accessing care, not because of a supply and demand issue, but because of the fear of saying that they need help or not knowing how to figure out who to go see or how to get an appointment. What is the role of philanthropy in trying to bridge that gap?
Let me, before I go to the kind of on the health equity issue, just about the role of philanthropy a bit, because you said, Shane, that working on things that uniquely psychiatry can do. And I think part of the role of philanthropy is trying to figure out what are those things that uniquely philanthropy can do. One thing I love about this conference is the real through line around partnership and public-private philanthropic partnership. And we are a very generous foundation. But if you think, just for example, if we were giving away $5 million a year in mental health, which would be a lot for a mental health philanthropy, mental health and well-being. But that is so small compared to the need. I mean, if you think about your budget or your budget of organizations that you've worked with. So to really think creatively about what is the research or leveraging opportunities. And I'm actively, looking for these ideas, because to that supply and demand question, we're asking, since we haven't developed a really focused strategy yet, what is the role of philanthropy? And sometimes it seems easy, to give money away, and it's a very privileged position, but to really do it well. So I would encourage you all with actually answers to that question that you have. I'd love to hear them. And then to your point about and there's been talk in other sessions about your zip code more determinant to your health than your genetic code, and that there can be great inequities geographically. And I think when we think about well-being and mental health, if you just imagine yourself if someone who had 2 jobs and didn't have a car, and didn't have healthy food. I mean, you can just picture in your mind just how challenging that is. And of course, you would be experiencing some degree of anxiety and stress just from your living conditions alone. So I think in philanthropy, when we think about what are we solving for, people in communities don't think of themselves as a mental health issue or a low-income issue or an environmental issue. They're just trying to live their lives. And I know at our foundation, our areas of focus are mental health and well-being, democracy, climate change, youth development, and then some geographic focus on Atlanta's west side and in Montana, which are the places the Blank family businesses and close to their hearts. And at first blush, you might think like, wow, why those issues? What's the intersection? But when I speak to my environmental colleagues, we talk a lot about climate anxiety. And when you speak to young people, they say, well, I can't really picture my well-being in the future without thinking about the climate or about the extremities of politics these days. So we're looking for those intersections, but for sure, people in communities who have been underserved and haven't had role models with the people with lived experience. So to the supply of psychiatrists, what could we do for young people and in communities of color to have role models and to build trust with those who are serving them? Because think about if that's a negative experience, then you're probably not going to access the service again, and you're definitely not going to choose that as a profession.
So you heard from two supply side people. I want to represent the demand side and talk a little bit about what happened during the pandemic, because I think it is an opportunity for me to geek out for a second and to spend 90 seconds talking about biology. And my theory is that the more we understand the biology role of mental illnesses, that could be an antidote to some of the stigma that is associated with the idea that mental illnesses are different than physical illnesses. So if any of you were made to take Latin or Greek, or you made that terrible decision on your own, this is your one opportunity to use that potentially useless information, which is that in psychiatry, we understand the development of mental illnesses according to a model called the stress diathesis model. And in Greek, diathesis means literally of God. We reinterpret that to mean a genetic predisposition. And we know that there are different mental illnesses that run in families. And in order of penetrance, they are as follows: bipolar disorder, schizophrenia, major depressive disorder, substance misuse problems, suicide completions. And I want to spend just 10 seconds reiterating this. Dying by suicide, which is a terribly uncomfortable topic, runs in families. And we know that there's a genetic predisposition or diathesis to suggest that somebody who has a first-degree relative, in particular, has a much higher risk of dying by suicide themselves than somebody who doesn't have that in their family. Yet, not everybody from a family who has a member who died by suicide dies by suicide. So the other part of this is the stress part. And we learned a ton about stress during the pandemic, when people initially were told to socially distance themselves. I never allowed that phrase used in my presence because I think it sends exactly the wrong message, instead of saying physically distance from others so that you didn't contract the illness. But what we saw is that there were not only psychological stressors, but for people who were infected with COVID, they had a rush of inflammation. And what we're starting to see is that predictors, particularly socioeconomic predictors, social determinants of where you live, what you eat, how you get around, who you count on for support, that those things can be very pro-inflammatory. And so in psychiatry, a new standard of care, and this is not something that I'm making up, it was on the front cover of Nature magazine, which is probably one of the best scientific periodicals in the world, but there's an association between uncontrolled inflammation and really all mental illnesses. And so one of the things that we're reconceptualizing is if you have the diathesis for bipolar disorder, but those genes aren't active yet, what can we do to prevent them from turning on so that somebody with that diathesis doesn't go on to develop a full-blown mental illness. And this is where the stress part comes in. So I want to spend a minute talking a little bit about the difference between mental illness and psychological resilience, because I think we confuse those two topics, which is that when somebody's symptomatic, they have a mental illness, but somebody who has a bad day at school or work and cries probably doesn't have a mental illness. They just are having a bad day and need to work on figuring out how to get through it in a resiliency way. So from your perspective, Shane, what can a workplace do, or what can employers do to think about, well before somebody ever presents with a mental illness, how to cultivate resilience and well-being in their employees? Or is that the job of somebody else?
Well, I think it's the job of everyone. First of all, I wish this wasn't a panel. We just listened to you talk for 45 minutes, because that was great. One reaction I had also as you were talking, and I think you mentioned this earlier about the connection with processed foods and talking about inflammation. I've been saying this for years. I think one of the great challenges of our generation and our lifetime is the food supply. I mean, for the first time in the history of humanity, you have to be wealthy in order to be skinny, right? I mean, for all, forever, it was, if you were, obese, it was a sign of great wealth, because you were the only ones that could afford the sedentary lifestyle and to be able to afford all those calories it took to get that. It is completely changed now. The food that can be afforded by those in poverty is the worst for them and the most inflammation causing. And I think that's a great societal challenge for us. Not every business can do this, but because of that, we maybe sometimes the chagrin of our associates, but are very purposeful about the food that we supply in the cafeteria. They can still every once in a while get the pizza and stuff, but we're very purposeful about that. But I think kind of in general around the anxiety piece, I think there's just two things I would maybe offer if you're a leader of your business and you're thinking about this. One is that we are very big on what we call our fail-safe environment. And some of it is very practical in that if I punish failure, I completely cut off and inhibit innovation. Because as you know, innovation is a messy process. I'm going to fail many more times before I get to the one that finally works. And so I want an environment that embraces failure as an opportunity to learn, not that punishes it and keeps people from doing creative things. And so I think the message there as a leader is to understand that you have the power to incent and prevent behavior. And so if you are using that in a way that is adding to people's fears of failure or whatever it is, then I think it's A, unhealthy and unhelpful, and B, it's actually bad for your business. The second thing, and this is a very practical one, stress gets a bad rap, right? People, we can't have stress. Well, actually, you need stress, right? Nothing ever gets done without stress. Like, you don't accomplish anything without working hard, right? That's how you need stress. The problem is not stress. The problem is not recovering from stress. I mean, we see this in sports, right? You learn this in your health class, right? You work out hard, break down the muscles, and you let it recover, and it builds back stronger. As a leader and as a business, we obviously impact the stress part, the hard work part. We also tremendously influence the recovery part. And I would tell you, especially if you are in, a white-collar job, professional job, and that sort of thing, in our organization, it is not a badge of honor to say you're always available on your phone. In fact, the people that I work with every day know that, like, I will test them. When they go on vacation, I'll text them or call them, and if they answer, they get in trouble. because I'm like, look, selfishly, when you're here, I want you working your butt off. I want you working hard, right? But I know if you don't recover and you don't have those mechanisms in your life to help you recover and manage the stress and the anxiety and all of that, that you're going to break down. And it's not going to be good for you. It's not going to do me as well. And so I think as leaders, we have to think about those things in terms of how we yield incentives.
Well, I've seen Shane surrounded by people all morning, and I've wondered why. And now I think they all want to work for you because
I do.
People want to work for a strong cultural leader. And it's easy to say what values are, and it's really hard to operationalize them. So it's really inspiring about how you're operationalizing values. And I feel really lucky to work for Arthur Blank, who's done the same. In terms of workplace well-being, and I appreciate your clarifying on the language, because I do think probably I use the phrase mental health, and sometimes what I'm talking about is resiliency, and language matters. But in the workplace, recently the Surgeon General put out a report on workplace mental health, and it has a really practical framework on it. And I think the shift in workplaces that he is suggesting and that we're living in is that having insurance that offers mental health as part of the coverage is necessary but not sufficient as a good employer. And his framework says things like psychological safety. Is your workplace a place where people feel like they can disagree and speak up? Sleep. Is your workplace one where you're allowing your employees enough sleep? Autonomy in their job. Do they have control of what they do? Flexibility in how they get their work done. So I think there's a new level of responsibility being put on employers that is not just like, well, some of your staff will show up already with mental health challenges that you need to have some role in providing service for, but that the workplace can be the cause of some of this. And to the employer, we think about this as kind of a continuum from crisis to stability and stability to flourishing. And some of the metrics we've often thought of in philanthropy and in other fields of success have been like, you have a job or you're in school. And that's a metric, though, for some sort of stability, but that doesn't mean you're flourishing. And I don't think any of us would say of our lives, our dreams are to be stable. But what does well-being look like, where you have the reserves that you need to be a great employee or employer, family member, citizen?
Good sleep, good eating, good safety psychologically. You just described the antithesis of medical training. So I want to work for both of you. But in psychiatry, one of the tenets that we tend to think about in defining mental health or mental well-being is using a variety of different defense mechanisms or defense strategies to get through various hard things. So for example, if you always make a joke about something, that works maybe 40% of the time. But if you're really sad at a funeral, making a joke is probably not the best defense strategy to get through that difficult situation. And a huge component of the diversity in defense mechanisms is having people who can support you and to give you feedback and to say, oh, that worked really well, that one didn't work so well, so why don't you try something else? And the interconnectedness of a community of people who actually care for you. And so, Beth, you alluded to Dr. Murthy's landmark Surgeon General's report last spring, where he indicated that loneliness is a public health emergency, and that being lonely is the equivalent to your health as smoking 15 cigarettes per day. And I love that analogy because it quantifies things, it makes the elevation of the importance of thinking about interconnections and communities that much more relevant. So, Beth, what do you think is the strategy that philanthropy and people who are concerned about climate change and access to food and all the things that the Blank Foundation is focused on, what can they do to help foster that sort of interconnection? And part B, is there a role for technology in that? Or what is the role for technology?
Well, and you're right, in that report on loneliness, just to see these indicators that have just gone down over time, and this started pre-pandemic. So I think we talk a lot about loneliness because of the pandemic, but our connection, doing things like this is a good example of non-loneliness activity today, being together rather than on a Zoom. But things like having a close friend at work, or going to church, or going to civic associations, all of those going down over time. And of course, that's at the same time as the rise of social media, which is like all of us living in a big experiment. Because we don't fully know what's going to happen. And so I don't have any good answers to your question, but who we're turning to help answer the questions are young people. We've done an interesting project in partnership with an organization called Hope Lab, based in San Francisco and started by Pierre Omidyar, who was the founder of eBay. And we're looking at this intersection between mental health and technology. And we are funding young leaders in college or in their early 20s who are leaders in mental health, digital mental health. And it's really fascinating to be with them and learn from them. I do think they see a more nuanced view of social media than maybe we give them, some of them credit for. They are actually advocating for more regulations on social media, and many of them and their friends have experienced what they identify as addictions to social media. So again, not the answers, but I think we should turn to the young people to help find the solutions.
Shane, I'm keeping my eye on the clock, and I have the awful job of winding down in about 4 or 5 minutes. So I want to end with kind of a more general question for you, which is a call to action. If you think about employers and responsibility of people who are part of a community of employees, key decision makers like the people who are in this audience today, what is your call to action for them? What can key decision makers do to help with the epidemic of loneliness and despair, but all of the sequelae of mental illnesses and mental health problems that stem from those things?
There's a pretty famous TED Talk that was done by a doctor who leads the very famous Harvard study that started following a class of students back in the 1930s, and it's grown, and he ends that with the statement that you two just talked about. And he says, "Loneliness kills." All right, and and I would say, if that's true, and I do believe it's true, that loneliness kills, then healthy relationships heal. And I think the answer for this is very difficult in the environment that we're in, as we just talked about, as we're more isolated than ever. We're connecting in new ways digitally than we ever had, and really disconnecting maybe more so. Is realizing that, as you said, the answer to, or what will lead to the answer to most of these problems lies primarily in healthy relationships. And the first thing I would say is, I think we need to look at ourselves and have the awareness of saying, like, if I'm struggling, if I'm not exhibiting resiliency, like I probably need to lean in, seek out, find some healthy relationships. But also being aware of the fact that in a society where we have fewer touch points with other people, fewer areas of community than we ever have, it makes all the more vital the relationships that we do have. And realizing that it is mutually beneficial, as much extra effort as it takes to ask the questions, to spend the time, to dig in with someone, despite that it's uncomfortable. It's the best thing we could do for them, and it's probably the best thing we can do for ourselves. And I would just encourage, even as businesses, leaders, all of us, get past the fear. overcome the inertia of just not wanting to do anything different, and just lean into people.
And I want to piggyback on the importance of communication. I talked a little bit about suicide earlier in our time together, and I would be remiss not bringing up this horrible topic again, because one of the things that I was trained to do in the way that I think about mental health and mental illnesses is to prevent the worst thing that could happen. And unfortunately, the common final pathway for untreated mental illness is suicide. And it's a public health emergency. And I wanted to dispel a myth and encourage you to speak about suicide. If a friend or someone at work says, you know, I'm really depressed and I've started drinking more than I typically do or whatever, it is perfectly fine and advisable for you to say, you know, sometimes when people feel that way, they think about suicide. Is that something that you're thinking about? It does not increase the likelihood that somebody will make a suicide attempt if you ask about it if they're not already thinking about suicide. I equate it to talking with adolescents about sex. If you ask them about sex, it doesn't make them want to have more sex because they already want to have more sex. So it's a safe topic to bring up and to think about suicide. And when you talk about it, and I'd encourage all of you to have a meaningful conversation with the people you love about this, use the appropriate language. And instead of saying successful suicide versus an unsuccessful suicide, we really want to reframe it as a suicide attempt versus a suicide completion. Because if you talk about a successful suicide, you're really sending a mixed message that there's something really positive about dying by suicide. Fortunately, there's a national hotline now, 988, that you can call if you know someone or if you yourself are in a situation where you're thinking about suicide. In Georgia, we're really fortunate to have the GCAL hotline. And so there are resources, and you don't get stuck trying to be a clinician or to manage an emergency like suicidality if you ask about it and someone confides in you that they're suicidal. So talk about it, and I think that that's probably one of the best ways to cultivate a meaningful community. Beth, final call to action.
Well, sure, and just building off of the communication and the relationships. You know, really to solve this, we need to change the systems of our healthcare system and access. And in one of the earlier sessions, they were talking about, well, do we move at the speed of government, or do we move at the speed of business, or do we move at the speed of money? And I think what this conversation is about is moving at the speed of trust. And that we are all in systems. Even if we can't take on the big system, we're in a system of a family, or a system of a workplace, or a system of a friendship. And in those systems, we all have a role.
Well, on behalf of the three of us, I want to wholeheartedly thank you for sticking around, for your attention and interest in this topic. Thanks to Russ for the invitation to come and be a part of this important dialogue today. And please take care of yourself, but take care of everyone else too. Thanks.